We're very lucky to be joined by Dr. Emma Beacom and Dr. Sinéad Furey, who are going to speak to us about social supermarkets. Emma is a lecturer and co-director of the BSc Food Marketing and Entrepreneurship Programme in the Department of Food Business and Development at UCC, lecturing on food marketing, food business sustainability and consumer behaviour. Her research interests include food poverty, social supermarkets, food choice and sustainable diets. Sinéad is a senior lecturer on the Food Business and Innovation undergrad programme at UU. She's lecturing on food and consumer policy and legislation, including active citizenship and sustainability. And her research interests are food insecurity and food policy. Emma and Sinéad will provide an overview of social supermarket implementation in Northern Ireland and will present a framework for development and management of social supermarkets informed by research and a knowledge exchange webinar involving participants in Ireland and Northern Ireland. You're very, very well.
Sorry, do you have the clicker? Is that up there? Is that the clicker? Yeah. Thank you. Oh.
Please.
So good morning, everyone. So myself and Sinéad are going to take you through some of the findings from a project that we've been working on social supermarket knowledge exchange. So most of you are probably familiar after our presentation, certainly earlier, with the concept of social supermarkets and that they've been introduced as a more sustainable alternative to food banks. So they're considered to provide more dignity because they allow members with the choice of choosing food rather than receiving a ready-made food parcel at a food bank. And they're also considered to be more sustainable because, as we heard earlier, participants are not just going and receiving food to meet that immediate need. They're attending skills courses and so on to try and develop skills in the longer term. In Northern Ireland, social supermarkets have been operating since 2017 following the Department for Communities pilot. And there were initially 5 social supermarkets that were piloted. Now, I'm not sure of the exact number that are currently operating in Northern Ireland. I know our speakers earlier mentioned, I think they were supporting 12 or 13 via Fair Share. From information that we had looked at online, we had approximated that there were around 30, but maybe that was a generous estimate. But certainly they've been quite well developed in Northern Ireland since that pilot, but in the Republic of Ireland, the development of social supermarkets is more limited. So we had identified a knowledge gap among stakeholders, particularly in the Republic of Ireland, regarding how to implement and manage social supermarkets. That was really the background to this research. So our aims were to create knowledge exchange between stakeholders in the north and the south with regards to developing and managing social supermarkets, and to develop a framework to inform development and management of social supermarkets. So to do this, we went out and we spoke to 9 social supermarkets operating in Northern Ireland. So we went out and did observations. We looked at how they had the social supermarket set up. And we asked the managers questions related to their operational aspects. So where they sourced their food and the types of food, the wraparound that they offered, how many members they were able to cater for and so on. We talked to them about challenges or barriers that they'd experienced, either setting up or running the social supermarket, and any advice that they would have for new social supermarkets setting up. We then analysed that data and we developed a draft framework, and we presented that at a stakeholder event back in June. And we collected some further feedback then on that framework, and we then went away and refined it and further developed it. And we now have an 11 aspect framework to inform development and management of social supermarkets. So that's what we're going to present to you this morning. So I'll take you through the first half of the framework, and then I'll pass over to Sinéad and she'll take you through the second half. So the first aspect is the operational model. Most of the social supermarkets that we visited followed quite a traditional social supermarket model in that they offered the reduced cost food provision with wraparound support, and typically that was mandatory, but in some cases it was just advised. One of the social supermarkets was quite interesting in that they had their social supermarket provision, but they also had an affordable food club. So it sat separate to the social supermarket, and it was used as like a transition store. So people who had been members of the social supermarket and had finished their term there would, in some cases, transition on to the affordable food club. And it didn't include wraparound, but it did include lower cost food provision. Or they also spoke about how there were certain groups of people who may have went directly to the Affordable Food Club. So for example, older consumers, they would have said maybe didn't like the idea of coming to the social supermarket and getting a free shop, even if they're paying a nominal amount of say £5, but they were happy to go to the Affordable Food Club and get the food items at a lower cost. Or they talked about students as well, who maybe didn't necessarily need the wraparound food or the wraparound services, but just needed the food support at that point in time. And then there was a third model in the sample. So they were quite interesting in that they had evolved from being a food bank to a traditional social supermarket to a community-wide food model. And they had a tiered discount strategy according to member income, and then that allowed them to be primarily financially self-sufficient. The second aspect then is food provision. So all of the social supermarkets that we spoke to, apart from the financially self-sufficient model that I just mentioned, the rest of them are all primarily reliant on food redistribution organisations for most of their food, but they all had other sources of food supply as well. So they weren't just relying solely on the food redistribution organisations, because they recognised that the types of food and the volume of food that they were getting from them could change on a weekly basis. So they would have had their own relationships with local food manufacturers, businesses, butchers and so on. And then they would have also had private donors or local businesses who would have donated money, or fundraising that would have brought in money that they would then have went out and purchased other food to supplement their food supply as needed. And that was considered really important. Something else that was important was considering food appropriateness and special diet to life stages. So they would have had different provisions for maybe gluten-free diets or kosher diets, baby food. Some also offered free items. So if there were items that were coming close to the date or that were past the best before date, rather than including those in the members' quota that they were paying for or getting for the fee that they're paying, they would have offered those free. So again, it comes back to that dignity aspect too, where you're wanting the members to be getting good quality food. And some also offered free fruit and vegetables as well to incentivise healthy diets. Most also retailed non-food items like toiletries and cleaning products. And then one of the social supermarkets, they offered additional food partial provision for any who were unable to participate in the social supermarket. So maybe people who had severe mental health conditions or who presented a significant security risk and were unable to attend in person. Aspect 3 then relates to considerations around the terms and conditions of the membership. So members will need to think about the membership criteria. So is it going to be means tested? And if it is, on what grounds? So some would have set a certain income threshold, and if prospective members were below that income threshold, they were eligible to be a member. Others wouldn't necessarily have did the checks themselves, but they would just have taken it that if the person was eligible for benefits, if they were already receiving benefits, then that was kind of their means, the way that they means tested. And others would have had guidelines around where the members were coming from, how far away they were and so on from the social supermarket. Duration of membership is another consideration. So in our sample, the duration varied from 12 weeks to 12 months. Monetary contribution varied as well. So some took the approach of a fee per shop or per week, and some took a pay per item approach. And then others would have had a set, say a monthly membership fee, a small monthly membership fee. And then they would have also had a pay per item up to a certain amount as well. Capacity is also another consideration. So how many people or shops will you be able to reasonably support with food and with the wraparound services? And one of the social supermarket managers had discussed how, you would be better if you're starting off just to take on 20 people and be able to give them food and support them really well with the wraparound, rather than trying to, taking on too many people and not being able to give them that one-on-one wraparound support. And in our sample, the member numbers range from 50 to 300 per quarter. So obviously that's the numbers you can take on is highly dependent on the number of staff and volunteers you have and the size of your premises and the amount of food that you have available as well. Aspect 4 then relates to the terms and conditions of the shop. So most all or most of the social supermarkets that we visited permitted usually a weekly shop. One had a fortnightly shop. One or two had the approach of using almost like a coffee card. So you got 8 shops and you could stamp it off and use those as and when. There was variation then too in the way that items were priced and the permitted quantities. So there were different approaches. Some used a colour or traffic light approach. Some used shape coding. One had a set shopping list. So there were a set number of items that you could choose under each category. And then another had the approach of choosing items at cost price up to a certain amount. There was variation in the days and times that they were open as well. So typically, I think it ranged in our sample from them being open 2 to 4 days a week and usually open for a few hours per day that they were during the days they were open. And some would have had an evening slot as well to facilitate people that were working. Most of the social supermarkets allowed for flexible entry, so members could come and go and do their shopping during the opening hours. But there were a few that used the approach of having a set timetabled slot for each member. So they would be allocated 10 or 15 minutes to come and do their shop. And then obviously that would have limited a little bit more the amount of people that they would have been able to take on per day and per week. Conditions of entry was also something that was discussed by the managers. So thinking about or being aware of in advance, thinking about how you're going to deal with people who are under the influence of substances, for example, or safeguarding around maybe people coming who might have criminal convictions. So thinking in advance how you're going to deal with that and having enough staff on hand. And then accessibility is important as well. So perhaps you may need to translate signage or shopping lists for foreign nationals, and physical accessibility is important as well. Aspect 5 then relates to the considerations around the wraparound support. So it was often referred to, I think some of the quotes earlier and from the previous presentation alluded to this as well, that the wraparound was the most important aspect, even more so than the food. In most cases it was mandatory, but in some cases it was just advised. And there was some discussion too around signposting versus monitoring engagement. So one of the managers had said that they didn't think the signposting approach really worked. So they didn't like, giving someone a card or a number and telling them to go and follow up and make the appointment with the wraparound service provider themselves. They would have made the appointment or referred them on and followed up to check that they were engaging and that they were getting the most out of the support services that were offered while they were there. They also would then have had their own processes to review needs. So they all had an initial needs assessment with prospective members, and then they would have different follow-up procedures throughout the duration of the membership to check how they were getting on and at the end of the membership as well. Another consideration then is if the wraparound is going to be offered in-house or if it's going to be externally provided. And obviously if it's going to be offered in-house, there's considerations there around space allocation, for rooms and staff and skill set needs and training as well. And you can see in the slide 2 photos of 2 of the wraparound rooms in 2 of the social supermarkets that we visited. Aspect 6 then related to building community. So most of the social supermarkets had a social space where members could sit down and have a cup of tea or coffee and talk to each other. So it wasn't just about the food and the wraparound, it was also about creating opportunity for members to socialise. And some would have held weekly or monthly or seasonable social events. And when we conducted the webinar in June, some of the feedback or one of the comments was that it would be important to engage with the community during the development stage. So to consult with them and have them all be aware of what you're doing and be aware of other food supports in the area as well. So you don't want to duplicate anything that's already happening. And another comment was around how engagement strategies may need to be tailored to different age groups. So the point was made around older consumers, for example, who might not be on social media. So if you were promoting what you were doing online, they might miss out on that. So there may need to be a targeted strategy for them that would be appropriate in that community. So I'll pass you over to Sinéad now and she'll take you through the rest of the framework.
So just continuing on in this sort of 11 aspect framework, we also find from aspect 7 about the importance or the benefits of also integrating technology. So something to bear in mind there, because some of the labour is really, really sort of person intensive. So things like opportunities to simplify the referral system or to track memberships. Maybe there are, entry and exit interviews, just check-ins. In terms of record keeping and in terms of even stock taking, things like that, where there may be the opportunity for technology to simplify or streamline the system and to save some time or some other vital resource in terms of the human resource, if not even the time. There are also things like there may be the opportunity to buy in and subscribe to pre-existing systems, IT systems that can simplify that for you without you having to design from scratch. So it's something, and just to name one, and the others will be available, but the things like your local pantry, people find real benefit in terms of buying into and subscribing for that in order to save exactly that time and resource that we're talking about. So don't underestimate the importance and the ability to integrate technology to simplify the job, because as Emma said, it's not just about the food, it's about the more intensive wraparound support. So why not try to free up some time with technology? Aspect 8 was around the compliance with legal requirements. So because we're dealing with food, obviously that requires food hygiene inspections and food hygiene monitoring from your local council. So obviously we need to register with that and get that paperwork underway in order to establish ourselves. And there's that importance of complying with legal requirements for food hygiene and food safety. Obviously, there's no market for unsafe food, so therefore it's important that we comply with all. And that also requires the sort of upfront investment of time in terms of staff training. And it's about, of course, feeding into that should we ever need it, due diligence. So maintaining our up-to-date records for inspections or if the worst happens. So it's about having appropriate insurances in place as well, things like public liability. Aspect then 9, I might labour a little bit too long on because we have to celebrate our volunteers here in terms of the absolute Herculean job they are doing to support our most vulnerable citizens. So staffing must not be underestimated. So we have to consider the requirements that we have for staff and for volunteers. And I don't mean to separate them out, but it really is important that there is at least one paid member of staff for the purposes of the previous slide. We've just talked about the legal requirements. And sort of the opportunities that there are for, unfortunately, sometimes things to go wrong. So we need somebody to be accountable and to assume that responsibility, and that really does require a paid post. But the team of volunteers in support of our most vulnerable citizens, I really, really want to celebrate. And I would say as well, without getting too preachy, the work that they are doing would be what I would call that shifting governmentality of food aid. The third sector is working on our behalf in an area that really, I would argue that the public sector has the responsibility for. So the staff, the volunteer training is very important. It can sometimes lead to ideas like, future employment in terms of the training that volunteers undertake. But I do want to just flag up here that the work, the burden that those volunteers and paid staff members are absorbing on our behalf can actually lead to fatigue, to burnout, to turnover, and to hunger trauma, where people working on the front service are actually experiencing the sort of the real repercussions of the moral duty of making the decisions about who gets help and who doesn't. And you preach about that one, sorry, Emma. Aspect 10 then was around the outfitting of the store, and people have already said that. Emma, you've said it as well, about the importance of space, the importance of the social space. So it's about the outfitting of the store. So bear in mind, again, we've said earlier about the benefits and the preferences that there are for fresh food, for frozen food. So that requires space to accommodate fridges, freezers, shelving, shopping baskets and trolleys, because we want it to be an authentic experience in terms of shopping the aisles and picking your own food. So it could be other space needed as well, like the bench till area, the till system and all of that. And we know that space is a premium, but it's also important that we have that space for social provision and for the wraparound support. As I say, the importance here really is around the authentic shop. So it's about having signage and labelling. We may be using different mechanisms in order to sort of guide people as to what they choose and how many they choose. But it's really important to have that authentic signage and labelling so that people, it doesn't feel other. So that people are ready to transition back to the ambition that was articulated earlier about going and shopping regularly again. It's about, as I say, the space being a premium for additional areas like those wraparound services, those meetings with members. They are intensive in terms of people's time and expertise, but it's also intensive in terms of the space required. So we need things like, the logistics around tables, chairs, screening for privacy, and the social area, because what we're having here is using, people said it already earlier today as well, about food is the mechanism that gets you over the threshold. We can have really purposeful and meaningful conversations around food. So it's important to have that social area. For some people, perhaps that's their one opportunity to be out of the house. And of course, there can be opportunities from a corporate social responsibility perspective for items to be donated by local businesses. Last but not least, in terms of aspect 11, the funding. Northern Ireland, we've benefited really from a unique context in that we've had sterling support from Department for Communities in terms of funding that pilot and the learnings from that pilot. And then year on year, we have had committed funding from Department for Communities. So that annual funding, and I know people have commented earlier as well about, let's look at multi-year and the rest, but at least we have that annual funding to support social supermarkets in Northern Ireland. But they're not standalone, and we do have to look elsewhere in terms of additional funding supports. And the social supermarkets that we visited are getting also, as I say, that corporate social responsibility sort of donations from local businesses. There are also private donations, perhaps even anonymous donations. Fundraising activities, either by the social supermarket or schools and other businesses and communities in the neighbourhood. Other streams of income as well in terms of catering trucks and opportunities. And again, we've heard that from previous conversations this morning. So it's important to identify the costs up front, to know what it is that we're signing up for, to inform the funding requests that we submit. And of course, it's important, and others have said again today, there's nothing new here with respect to this element in terms of it's multi-year funding, but it's about how can that funding be used? Are there constraints on that funding? Does it have to be for infrastructure, or can it be about staffing costs, or can it be about about the food donations or the utilities or the insurances that are rising year on year? So all of these are hopefully a little cheat sheet that we have come up with in terms of if we are looking to either start a social supermarket from scratch or to grow from a food bank into an alternative model, just some thoughts to bear in mind. Signing off, I guess, with a few little unique intakes from our managers' perspectives, and these are just from 4. But it's in terms of, it's been a challenging experience for us, so let's not underestimate the commitment up front, especially in the first year. So there is this idea of needing a lead-in time before you can start to see the benefits and the dividends. But the outcomes, the successes have heavily outweighed the difficulties, and we are so proud to be part of this project. Somebody else said how the social supermarket has been life-changing for people. So again, of course, we wouldn't expect otherwise, but managers are saying we're doing it for the people. This is the reason that we thrive in this space. Somebody else commented that this best project of my 30 years of community working. So it's truly transformational, not only for the citizens we're helping, but also for the leaders who are stepping out and doing this. And overall, if you can just do it, it makes such a difference to people's lives. As I say, the reason for doing it, being person-centred, again, as somebody said earlier today. But for those of you who know me, you're not going to get away with just talking about all of the good things about food aid, because actually, I think we could be angrier in this space. So I'm going to say it, the food aid alone does not solve food insecurity. People have stood up here already this morning and said, we've been doing this for 30 years. North America has been doing it for decades before us, and it still hasn't eradicated food poverty and food insecurity. So just to be clear, as others have said, it's not a food issue. It's an income insufficiency issue. It is not a food sufficiency issue. So we've talked about the cost of living crisis. I call it the income crisis. So it hints at what's to come in the rest of our concluding thoughts. What we need is a long-term, sustainable action to be taken. We need to provide adequate financial resources for food consumption. Of course we do, because we have a human right to food. There is no substitute for food. We need to eat. We can't live on air. So we have to have financial resources in order to afford food. We've used the principle of dignity a lot today, and there's nothing more dignified than having cash in your pocket. So provide adequate financial resources in the first instance so that we can buy and access and choose our own food. Thereafter, let's look at supplementing direct food aid provision. But nothing can trump, in my opinion, a cash-first approach to address the structural causes of food insecurity. Of course, we want to make sure that good food, healthy food, sustainable food is easily accessible to everyone. And I guess because we're academic researchers, of course, we're also going to say that we need to continue to strengthen the evidence base, but we have to do that alongside parallel action. We just cannot continue to simply describe the problem. We need action-based research in order to inform this space. Going to say, I hinted at it at the start, but need for greater emphasis on the idea of healthy food as a matter of a rights-based approach, the human right to food. Again, I've said it many a time, how we are very quick to sign up as governments to treaties and covenants and declarations and development goals with respect to the human right to food. We need to stand by we need our actions to complement and supplement the words coming out of our mouths and our published commitments. And in the short term, of course, there's merit in raising awareness of food aid. In the meantime, we have people with hungry, rumbling bellies. We need to resolve that in the short term. But let's please never lose sight of the long-term need to provide structural, systemic, sustainable solutions. And of course, we've said the importance of wraparound support. We've talked about its intensiveness, and we need that those advisory support services to continue to be available without duplicating provision in order that people can be the best versions of themselves. Emma, I will shush there, but just to give a little final, it's not going over to the last button, but we have contact details that we can share should you want to be in touch. Emma has led this piece of research and it's been my privilege to support her, and thank you.